Welcome to Podcast, the Business of Dentistry Podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to Podcast. My name's Hazel Dockery from Practice Plan, and with me today is Fiona Ellwood. We've only got 15 to 20 minutes, so she's got that many titles. I'm going to let her introduce herself and explain a bit more because we just haven't got time to go through everything. Every time I speak to her, she's got a new job or a new title. Anyway, what's today's, Fiona?
I always find that really funny. And you're right, it does take up so much time. And it's never about titles, is it, or qualifications? It is just about moving into new and exciting things that create opportunity for other people. So my latest add-on to the list is becoming the Lincolnshire LDN DCP chair. And if you're in Lincolnshire, you'll know that I'm looking for you and I'm trying to get you to the table if you're a dental care professional. So that's probably enough on that one, but it's really exciting. We've got great opportunities and what a great subject to run into this.
Yes, because today we're going to be talking about Squiggly Careers, which is a brilliant title. Love the idea. So can you explain a bit more about what it means, please?
Yeah, absolutely. So, I love the term, like you, myself, I love the squiggly career. And I think part of my ambition to bring this to light for everybody is that all too often we hear about career trajectories or career ladders or, climbing the ladder or, career progression. And not only are they ingrained terms and historical terms, it's quite worrying when you look at how some of those terms came around, like keeping some of the less able people quiet by showing them a ladder and how they can move up it rather than really recognising their talent and their skills. And particularly for dental nurses, and it isn't just dental nurses, but we always hear this sort of challenge around being valued or having opportunities around dental nursing because there is no set way forwards, and that's something I want to explore with the Squiggly Careers because I think this opens a door to new opportunities, new way of thinking, and some real positive insight into what we can do, if not for the patients and the practices or the place we work, but for ourselves, because there's a bit of what do we want for ourselves and what is the need of the practice, and they are very different actually.
Yeah. So Squiggly Careers, it's a funny term, but it does actually describe how things go. As you say, things are not linear. Very few things in life are linear, are they? It's like the phrase "man makes plans, God smiles." So it's a bit like that kind of thing. So yeah, just explain a bit more about it, please. How you define a squiggly career.
Well, sometimes I have presented on this quite a lot, and if you can imagine a squiggle and you can imagine a straight line, to start with, what's more exciting and what's more boring? It is that simple. It is about looking at things differently and not accepting that everything is a straight line and that you go forwards in a straight line. Now, there is a book that's been written about it. I really like the whole concept, and I thought it really fits well with dentistry and how we go. So it is about being curious, being creative, being courageous, all of those wonderful terms, and about being excited about, the world of opportunities, the world of possibilities, not trudging the same old mill and the same old steps. I think the other thing that spurred me into this is I quite often see social media posts where we get sort of some dental nurses particularly, but again, it's not just them. They're doing all of these additional courses and don't understand why they aren't recognised for it, they aren't valued for it, they aren't remunerated for it. And then we get on the downward negative spiral. And, I like to question that. And Squiggly Careers is very much around questioning that concept of why we feel like that. Because did we take that course because we wanted something out of it for ourselves? Did we, want to understand more, learn more, open our minds? Did we want to grow personally? Did we take it because the practice needed the skill set and the patients needed the skills that we could deliver?
Yeah.
Or did we take it because we thought we had a right to more money because we had taken it?
Right.
And you start all of a sudden to see why people become disenchanted when really, if they stopped in their tracks and thought, right, I really love this side of dentistry. What can help me feel better about it? What can help me grow about it? And, if you do it off your own abolition, it's great if you're recognised for it and rewarded for it. But if it isn't a practice need, then there's a counter argument, isn't it? That must have been for self-development.
Mm.
If you go and do, say, for example, a station course, and it's an amazing course to do, and the care is different that you give your patients, and being a bit more sort of switched on into reactions and everything else and drugs, absolutely fabulous course. But if you go to work on Monday and your practice doesn't offer sedation, who has that benefited? So the Squiggly career, for me, it's my catchphrase on my first slide of my presentation says time to reframe the traditional career plans. And it is about that. I mean, we always laugh about what I've done in my past, and it is a standard joke with most people. But the fields that I have dipped into in my curious mindset and being creative about things, how they can help me, how I can help others through knowing those things, have taken me to fields that really enhance me as a person. They give me skills to look at things differently. And I've never once stopped and thought, I'm going to collect that award, that award, that award. I use the phenomenon of points don't make prizes. But there's also an era thing in this as well, if I dare add that, and I feel I can because I'm on the older generation, is that when I qualified as a dental nurse, you felt it really pertinent to take every qualification that there was out there, almost as though you had to prove yourself.
A bit like getting Girl Guide badges.
Exactly. And that maybe that's where I got it from, because I was one of those as well, and a brownie. As takes us down that path. But that is the whole thing I try and translate to people, is that it isn't about collecting things to make yourself feel valued. And maybe there's a part of that says, look at self and value self and look at what really will help you. And it might seem a little bit selfish to say, if you're putting yourself first, you need to look at what really makes you get up in the morning. What is it that motivates you and that excites you, that makes you want to get up and go to work? It isn't the fact that you're collecting prizes. And it isn't the fact that you go to work thinking, will somebody recognise me for who I am? That's a different conversation, isn't it? It's about different things. But I just want people to embrace the Squiggly career, because I think it's a time where don't look at things in straight lines. We could all reel off the traditional qualifications and courses that, for example, a dental nurse does. And the other professional groups could do exactly the same. So, there is a list of common things that dental nurses tend to go and do. And, it is time to think differently. The world's different. Technologies come in. AI is running away from us. We'll never keep up with it. So we can either join in with the change, get on that merry-go-round, get off it when we feel like we're just overwhelmed, and then get back on it. But, there are times when you need to look around and think, hang on a minute, this isn't the same. And one of the beauties of being where I am in my career now is that I can see the changes. You can see the accelerations. You can see the things that happen and then disappear. And you can almost feel them, at the time that they come. I was tidying out, and this is a real concept. I was tidying out a cupboard at the weekend. It's one of my dental cupboards. And I needed to straighten it all out. And I got my journals in there from 1985, 86, 87, 88.
Oh, wow.
Right through. I've kept them all because I've also set up a historian group. But I use the analogy of finding a box of empty floppy disks and a box of empty CDs. Now, can we really remember the time span of how long they were out, and they were the in thing and then they were gone, and then the other one replaced the other? And actually, when I was tidying the cupboard, neither of them were any use at all.
No, that's true, isn't it?
So this elevation of the profession and the way forward at a rate of knots, we need to think differently. And the squiggle is a brilliant name. It's a brilliant concept, and it is about looking broader. And there's, the other things that I really embrace is not just thinking about, is this for the practice? Is this for me? And actually, what does it bring? It is around planning for the things that you love. And I had a conversation recently, and you may have been in that conversation, who knows? But somebody said to me, what was it that you loved most, or what is it you love most about dentistry? And it has changed over the years, actually, as you become profound and skilled in what you do and you find the next thing. And it has shifted, but I was always that dental nurse who liked to be in the thick of things.
Yeah.
The more surgical, the more complex, the more in depth, the more concentration, the more full on that work was, the better I functioned. And, I absolutely loved the oral surgery side of things. There's no getting away from that. And we do tend to fall, there is a middle ground now, but there was either people who really didn't like what we called the blood, guts and gore, and those of us who quite sadly thrived on it.
Yeah.
But, that there's things about self. But when you think about where have you made the most impact, that's the time when you stop and think have I made an impact? And the difference there is if you've gone and done a straight line, everybody's doing the same thing.
Yeah.
Yeah, they might pick the odd variation of the post-registration qualifications, but there aren't that many. There are only 5, 6 maybe. And I've got them all on a list. I can reel them all off on here for you. But if you've done it for yourself, like I've done mentoring, I've done coaching, I've done public health, I have done human factors, I've done education. And the reason I say I've done those is not to say I am any different or any better than anybody else, but then I sit back and think, what have they given me? And I had a squiggly career.
You've had the ultimate squiggly career, really,
I am
because
a
you've
squiggle.
gone, from dental nurse to associate professor now, or professor. That's you don't get there in a straight line, do you? Really?
No, never.
So, do you think it took? Well, I mean, I've been fascinated about what you've been saying, but it's been sort of coming to my head. What was your first step off the linear path, and did it take courage to take that step?
Yeah, I think it did. So the first step off the linear path was to start supporting student dental nurses at a time when the only other way than learning in the dental hospital was to do night school. And I was in a place where I was in Manchester. So I was in a practice in Manchester, and I was asked by a couple of dentists if I would support their dental nurses who were struggling with their dental nurse training course.
Right.
And then I became a local trainer or a support to training. And from then on in, that was my first job as, I say, head nurse. My very first job in practice, I was the chief cook and bottle washer because it was a brand new practice. So life's been courageous since I started. But going off the linear path, the education path, was when I was recognised as somebody who was deemed to have the capability and ability to sit and explain things in a simplistic way that help people get through their courses. And that was the start. It was courageous because I was in a new practice. I was head nurse. I got a new team around me, and it was hard walking into the new team because the new team all thought one of those was going to get promoted into the head nurse post. And it can be quite isolating if you're in that practice anyway, although I believe it's easier if you're not and you land as a head nurse. It is uncomfortable sometimes, but it was never meant to be straight lines for me, I've decided. And that's, now I'm talking about the squiggle. I know that a couple of other people in dentistry have had conversations about the squiggle, but there is a book about the squiggly career. But then you go back to squiggly career and I look at some of the work that's come out from those who design our work and our workforce and think, you really haven't got the squiggle here, have you?
No.
they present things and in the best possible way, the way that they know, the way that it's easy to fit into the systems. Maybe that's part of the problem, isn't it? The squiggle could be seen as disruptive, but if they just accept that in our field, particularly in dental nursing, we live in a squiggle because there is no right or wrong way. And we've got primary care, we've got secondary care, whilst we class community primary, secondary care, debatable as to where both of the workloads sit. But the reality is that to get those jobs, every single dental nurse will have taken the primary qualification. There's still some of those who were grandparented on, I'll give you that. But then they will have perhaps undertaken radiography, oral health, sedation, special care.
Yeah.
And then very few people diversify into the things that I did, which I think truly changed me as a person. So this is my biggest squiggle, really, is I decided to be really brave and apply for courses that were just for dentists. They weren't clinical courses, but they were titled just for dentist.
Right.
And because I'd taken certain quals, I thought, why is that just for a dentist? I don't understand. And I wasn't being provocative in asking the question, but when you've gone back to university and you've got an undergraduate and you've got a master's and you've got postgraduate certificates and you're a doctorate student, and they're saying it's just for a dentist, and I'm trying to get my head around this, and I'm looking at them quite confused, as I'm quite good at looking at confused because I am often. And I'm thinking, no, I need to ask the question out loud. So I did quite often. And quite often I said, well, you need to have worked to this level. You're a dental nurse. And I have worked to that level and beyond. Yeah. So they've given me the confidence, if you like, that self-efficacy, chasing the squiggle.
Yeah.
Each one. And I don't believe in, personally, my own values in the straight line, the linear line that we talk about in the career plan, because it isn't there for us. But it's because every time you pick up something new, you go around in a big loop. You become a beginner again. You're never going and progressing. When you're new at something, you flip him back round and you go back to a learning point and become that so-called vulnerable learner again. So how can we have a linear career? How can we walk in straight lines? And the fact that the career ladder, I challenge anybody who's listening to go and look at the history of the career ladder, and it was to keep the minions quiet and to show that they were moving up a ladder, but wasn't always a lot of recognition for it, but it was to keep us quiet.
Yeah
And it's not good, is it, for anybody to think like that?
But I suppose, I mean, a dentist cannot practice without the aid of a nurse, can they, at all? And so I think I agree with you. A lot of it is suppression, isn't it? Really. So stay in your box, love. Don't move.
Well, I was once told there's lots of stories because I've been around a long time, but there's some lovely stories, and I'll never forget the one where I went to speak at the Westminster Forum, and professionally, I'll keep names out of this, but away from the camera, I can talk about it. But I was on the platform with 2 or 3 consultants, and it was a brilliant morning. And I presented, and we were sort of in this horseshoe. I was in the middle of this sort of lineup of consultants and well-known, individuals and influencers. And somebody came up to us as a panel to congratulate us, and congratulated all of the others and then me. So there's this sort of other and otherness around this conversation. Yeah. And when that person got to me, that person put their hand on the top of my hand and said, "My dear, you need to understand something. Dental nurses should come to work and do as they're told, carry out their duties and go home. We don't need them to have a brain."
I am shocked. How did you not thump him?
Well, it was interesting because I would never do that anyway. I'm not that kind of person. But there was a couple of people around me that eyes just sort of widened and thought, oh, what's going to happen next?
Blooming heck.
You shouldn't accept it as the norm. But inside, it kind of brings a smile to me because I think, well, here we go again, and you need to move on. But that would be really rude. I would never, ever say that. So, ultimately, I just smiled and said, thank you for your comment. I said, I really appreciate it. But, do you know, times have moved on. And if you look, dental nurses are being included in so much going forward. And there's a real great document I'd really like to signpost you to. And that individual just smiled at me and nodded. And ever since then, we've been really good friends.
Oh my goodness. That is, but it won't have been just him thinking that way, will it? That's the problem.
Interesting you say it was a him.
Oh my God. I've made a huge assumption there.
Well, I'm not going to say you were wrong, but that's not the point, is it? But you know, it is interesting, but I'm really looking at that anyway as a concept. So maybe that's why you said it. And you know, I think it is just interesting times. But if you've got the squiggle, you become exciting. That's the other thing about the squiggle, is that you can be in any room and have any conversation, and you can tap into things that people think you perhaps shouldn't know about.
Yeah.
Because you've not only, it's not about the growth, it's not about going to university, it's about the reading and the way you absorb it and the way that you then apply what you have learned. And that's really important to me. I was in a conversation earlier this week with somebody else, and ultimately it was a work conversation and around well-being, and I just went off on one around, you know, the psychological safety and the impact that has, and went into my human factors as I would. I was like, oh, you kind of know your stuff then. But I think that person did know me, so she knew my background, but there would have been a tendency in a conversation with other people to say, what do you know about that? You know, it's really not, it's not in your box. So I think the squiggle for me leans into satisfaction at work as well, and around, you know, what you make of it. There's a little bit of, if I dare even mention the subject of job crafting, where those of us who are really keen on our job and don't just turn up 9 till 5 and can't wait to get out of the door. I know there's a difference between 9 and 5 and giving your all and having to get out the door. That's a completely different concept. But those of us who can create a job role which goes beyond the paper job role, it is called job crafting. There is a little bit of psychology on why we do it, but you know, the more that we can create a different role, a different space for ourselves, and that we can talk in a way that means that job role should be defined like that, you suddenly start to establish the real you within. And part of all the squiggle is doing the things, as I said before, that motivate you, that make you get up in the morning, that make you want to punch the air with success when you've done that, you know, the excitement that comes in. It's so easy to get on the treadmill and be a crowd follower.
Yeah.
You know, it's fun to be in a squiggly world and a squiggly career. It is about framing your squiggle and what your squiggle looks like, and ditching the ladder and the linear lines, because do you know what? Where does the happiness come with that?
Yeah. So as I said, your career is just probably, well, a scribble rather than a squiggle, maybe, because it's gone all over the place. So what advice would you give to someone who would like to step off the linear path?
Do it. Just do it. Find somebody else who's done it, or watch other people and see if those things that they're doing and the way that that's changed them, impact on them and how they can help others. If you like that, talk to those people and see what they've done. Don't go it alone, because some of us were some of the early people who've done these things, and only because it only takes one brave person to start it and then the rest follow and push the doors and the boundaries. But those people who've done something similar, something that attracts you, talk to them, reach out to them, follow them. And, you know, just look at what it is. And you know, with the thing with the squiggle I love so much is if you set on the squiggle, it's not the right squiggle, you can turn around and start another squiggle.
Yeah.
It's really hard when you get yourself in this trajectory where that's the goal. And then what's the next goal? And you're putting yourself under so much pressure. Whilst the squiggle collects things along the way. It's just brilliant. It just changes the way you look at things, and straight lines are just not me.
No, and it taps into something that Mark Topley always talks about. Sort of like people need meaning, don't
Yeah,
they?
and
At work,
purpose.
meaning and purpose.
Yeah.
And you're finding your own meaning and purpose there,
Yeah.
aren't you? Rather than waiting for
Yeah.
someone else to give it to you.
Yeah, I mean, never ever do that. You can push and push. And I think you've got to look at your own values and you've got to be able to find yourself. And that's part of a lot of the conversations. I know I've got one coming up where somebody in the veterinary world wants to talk to me about how did you find your voice? And it's really interesting, isn't it? Because and we could talk about other subjects forever, but there's a lot of people talk about imposter syndrome, and I really sit on the fence with that because I see where it comes in. But before I sort of even talk about that, I actually say, do you feel this is imposter syndrome, or is this about self-efficacy? Is this about understanding you and about having confidence? And is it that you lack, that you don't believe in yourself? And therefore you're framing it as imposter syndrome, or is it truly imposter syndrome? And that's why I think it's really not dangerous, but you've got to be careful when you jump on bandwagons. If you can start talking about things, you need to understand the other things around it, because you could be leading somebody down the garden path, and it's not fair to do that. But if I go out and talk about dental nursing, and one of the other things, I mean, I know you're going to have to flag me when it's time because I could talk forever. The more modern definition of a dental nurse came to fruition because a very recent publication by somebody in a place of influence put a definition out of a dental nurse, and it said, assists a dentist.
Yeah, and that was it.
And I just think, that's taken us right back to almost the 1800s.
Yeah.
I might even be courteous and say the very early 1900s, but come on. That role of being subservient and the handmaiden and subordinate and everything else that we've called in the past is gone.
Yeah.
We actually have a part to play in every patient's care.
Indeed, it's a partnership.
Yeah, and it's not about assisting a dentist. And we, for the record, have moved from the Dental Professional Alliance of calling people clinicians. Because hygienists and therapists and orthodontic therapists and clinical dental technologists, they are people working in patients' mouths. Their scope of practice makes them a clinician. As a dentist is. It's just different skill sets across the whole profession. But it goes back to my squiggle, doesn't it? Absolutely goes back to my squiggle.
It does go back to your squiggle, but it sounds to me that you've still got a lot of squiggling to do.
Oh, God, always. I have no idea when it'll stop, but I had a conversation with somebody who I hold perhaps in the highest regard this week, and he said, well, sometimes you've got to take a step back and let the youngsters like you take over. and I thought that was hilarious. But that's because the person who I hold in the highest regard is still working, but is in his 80s, and you think, okay, I'll accept that from you, but from others, I don't come across as that young person. But in my mind.
Do you feel that you need to take a step back and let some young people get on with things?
Well, they're getting on with the things that are generally and commonly dental nursing. That's not, what my world is. My world is the squiggle and the creating of the squiggle and creating opportunities for them to do that if that's what they want. So I think that, that's a conversation that I've moved away from, because other people are coming through and they should be coming through, but they're not looking at the squiggle yet. They're not there. They haven't really had the courage to get hold of the squiggle. There's quite a few who are they're dipping their toe in. But because I wouldn't say brainwashed into this, but it's just historical way of, well, you become a dental nurse and then you want to do the radiography and then you want to do oral health and then you want to do sedation. We might do special care. We'll definitely do fluoride varnish. But beyond that, the courage has to come from somewhere. Some of them are dipping into and have been for a while into the sort of level 3 type education qualifications Some of them are doing assessing qualifications, so it's a little bit of a step out, but those have nearly always been there. It's not taking that really courageous step and dipping out into things like human factors, public health. I mean, public health is amazing. And it actually folds back into how we think about oral care, how we think about dentistry, how we deliver messages, how we design brochures, leaflets, e-commerce, all the e-literature, our advertising, everything is linked to public health. And your conversations are so much fuller if you understand public health. So yeah, I think that time for me has gone about stepping aside. I'm in a squiggle. There's no side. I'm in a squiggle. It's not a bubble, it's a squiggle.
Yeah.
Straight lines are just not, it's unhelpful to anybody, I think, if I'm really honest, to talk about linear ways of doing things, because the excitement comes from the difference.
Yeah.
And the impacts, as well, the impact on you as a person comes from being different.
Yeah. I was just thinking then, a roller coaster, it's on rails, but it's all over the place.
Yeah.
So you can have your squiggly path, but still be following what you really love.
Yeah. Absolutely. And, if you think about one of the things that really sort of maybe ignited this was dental nurses qualify. And as I say, we go over those common additional sort of skills and duties. But if you look at all the specialisms that the clinicians have, none of our additional duties are really lined up to those.
No, that's
so
true.
What was that about?
Yeah.
What was that about? Was that piecemeal?
Well, it was. It's because you've forgotten, aren't you?
Well, because dental nurses are absolutely, and I'll stick my neck on the line here, dental nurses are absolutely capable of all of the additional duties that could be very much part of their primary course. With the exception of radiography that perhaps needs more time. Every single one of those skills, but radiography could be built in as well. It's only because there's added sort of chemistry and physics into that's not part of the core course, but that could be put into there and it could be taught as part of the core curriculum for dental nurses. Not one of those things, I believe, and maybe not everybody will agree with me, but not one of those things is something that is above and beyond what a dental nurse is capable of. That their additional scope of practice should really either give them those skills and the squiggle, the mentoring, the education, everything else. But why don't they work and complement the specialisms of the other professional groups that you work with?
That's a good point to end on, I think, because we could talk about this all day. Thank you so much, Fiona. It's been great to talk to you again. I always love speaking to you, and I will put your bio on in the details rather than taking up about 750 hours worth of time here. But yeah, thank you so much once again for joining us, Fiona.
You're very, very welcome, and don't forget the squiggle.